So prolotherapy is essentially going and treating each of these nerves with a dextrose solution. And the dextrose solution causes a little bit of irritation, and it's sort of like having the acute injury all over again. It's getting the immune system's attention and getting the immune system to come in and sort of resolve the chronic inflammation that's going on, as well as like clean up any injury. So what I do is I combine dextrose and procaine, and I like to use procaine because procaine sort of resets the nerve. It sort of erases trauma out of the tissue. And if any of you have been in an auto accident, you know that trauma can stick around for a really long time. So I like to just ensure that we're treating the tissue memory. So tissue sort of has a memory with it. So we treat the tissue memory, but we essentially go in around the nerve root. So you know these little nerve roots right here. We go in and we treat that, and we put some medicine around that, and we help decrease the inflammation in that. But we also, in doing that, strengthen the connections between the spinous processes or the transverse processes right here. And we also do this procedure, or I do this procedure, down in the sacrum as well, because there's, like I said, there's very large ligaments that maintain the structural integrity, and if those get compromised, then we need to shore those up to ensure that the muscle isn't doing a job that it's not supposed to be or not designed to do. Muscles are designed for movement, ligaments are really designed for structure, so or maintaining that integrity. So what I do is I go in and I'll treat the nerve root that's affected, and then I'll go in and we'll treat the ligaments that are affected. So if you've been to either a naturopathic chiropractor or an osteopathic physician, and you keep getting an adjustment of this sacroiliac joint, like, oh, your sacroiliac joint's out, you know, and you keep getting an adjustment, it keeps coming out, keeps going in, keeps going out, then consider that this ligament is lax, like there's laxity in the ligament, that we need to tighten that up. So the therapies that we utilize are designed to help shore that structure up to make sure that, you know, you're treating the root cause, so you're not continually getting adjustments and continually dealing with low back pain, hip pain, or sciatica symptoms. So the other ingredient that I like to use a lot is called ozone. So ozone is a gas, so I fill up syringes with an ozone gas, and the ozone dissociates in the tissue, means it comes apart in the tissue, and part of it is oxygen. And it happens to be that these ligaments here have very poor blood supply, and they're poorly oxygenated, and it takes them a long time to heal. So by injecting ozone into the tissue, we're actually oxygenating the tissue, and we're also causing inflammation. So, you know, I talked about the dextrose, and I talked about the procaine, and the dextrose causes irritation, and the ozone actually causes irritation in the tissue, and it stimulates fibroblasts and it stimulates growth factor, so it basically gets your body in gear and starts healing what's wrong. So we like to fix what's wrong, right? So the ozone goes in. The injections really aren't that bad, and that's a direct quote from hundreds of patients that have received treatment from me. It's sort of, I like to compare it to an acupuncture appointment. We're not being really traumatic to the tissue, we're not causing a lot of tissue damage. It's really placing the ozone or placing the dextrose, placing the procaine, and letting the body do the rest. So we're just giving the body the tools it needs to do the healing.